Chapter 1: Understanding Lupus. What is lupus? Lupus is an autoimmune disease in which the immune system mistakenly attacks the body's own tissues. This can lead to a wide range of symptoms including fatigue, joint pain, skin rashes, kidney problems, and heart disease. Lupus is often difficult to diagnose because its symptoms can mimic those of other conditions. However, there are several blood tests and other diagnostic tests that can help to confirm a diagnosis of lupus. Types of lupus: there are two main types of lupus: systemic lupus erythematosus (SLE) and discoid lupus erythematosus (DLE). SLE is the more common type of lupus and can affect multiple organs in the body. DLE is a less severe form of lupus that only affects the skin. Causes of lupus: the exact cause of lupus is unknown, but it is thought to be caused by a combination of genetic and environmental factors. Some people are more likely to develop lupus if they have a family history of the disease. Certain environmental factors, such as exposure to sunlight, smoking, and certain infections, can also increase the risk of developing lupus. Symptoms of lupus: the symptoms of lupus can vary depending on the type of lupus and the severity of the disease. Some of the most common symptoms of lupus include fatigue, joint pain, skin rashes, kidney problems, heart disease, lung problems, neurological problems, eye problems. Diagnosis of lupus: lupus is often difficult to diagnose because its symptoms can mimic those of other conditions. However, there are several blood tests and other diagnostic tests that can help to confirm a diagnosis of lupus.
Some of the most common blood tests used to diagnose lupus include anti-nuclear antibody (ANA) test, anti-double-stranded DNA anti-dsDNA test, complete blood count (CBC), erythrocyte sedimentation rate (ESR) test. Other diagnostic tests that can be used to diagnose lupus include chest X-ray, kidney biopsy, skin biopsy. Treatment for lupus: there is no cure for lupus, but there are a variety of treatments that can help to manage the symptoms of the disease. Some of the most common treatments for lupus include medications to suppress the immune system, medications to relieve pain and inflammation, medications to prevent blood clots, medications to protect the kidneys, lifestyle changes such as getting regular exercise, eating a healthy diet, and avoiding exposure to sunlight. Outlook for lupus: the outlook for people with lupus varies depending on the severity of the disease.
With early diagnosis and treatment, most people with lupus can live a full and active life. However, lupus can be a serious disease, and some people may develop life-threatening complications. Causes of lupus. Lupus is an autoimmune disease, which means that the immune system.
Sample complete. Ready to continue?